this correctly. Okay. So I'm delighted to present Dr. Pam Mirsky on this topic of mindfulness of emotions. Dr. Mirsky grew up near Philadelphia, earned a Bachelor's of Arts in English at the University of Pennsylvania in 2003. Then in 2007, she received her medical degree from Temple University School of Medicine. Then she trained at the same place as an intern in psychiatry, completed her residency at the University of Arizona College of Medicine in 2011, and then went on to do a fellowship in consultation liaison psychiatry at Harvard Medical School and Brigham and Women's, Dana-Farber Cancer Institute, and the Boston VA Medical Center. Then she, in 2018, completed her integrative medicine fellowship through the Andrew Weil Center and is board certified in psychiatry, consultation liaison psychiatry, and integrative medicine. She was the consultation liaison service director at Banner University Medical Center in Tucson, and then moved into integrated outpatient psychiatry. Man, she's done so many things, seeing individual patients with mindfulness-based psychotherapy, taught mindfulness-based cognitive therapy, MBCT groups for depression. She is a qualified teacher MBCT per the UCSD Mindfulness-Based Professional Training Institute. Has trained with renowned teachers, including John Kabat-Zinn, Zindel Siegel. She completed a 9-month certification program through Institute for Meditation and Psychotherapy, and completed the Mindfulness Meditation Teacher Certification Program. She has recently founded Mindful Hummingbird, one of the best names out there, PLLC, where she teaches mindfulness full-time. And that's one of the reasons we are so delighted that she's here to teach us about all things mindfulness. She remains associate faculty with the University of Arizona, and is also a teacher with Cloud Sangha, an online community that aspires to bring mindfulness to people in their everyday lives. So with that, and she's also a delightful colleague of mine for a very long time. So welcome, Pam, and take it away.
Awesome. Okay. So yes, thank you again. So nice to be here. So I thought I would talk a little bit about kind of mindfulness of emotions, and then also just how mindfulness relates to psychiatry. And oh, sorry, I just like lost my note somewhere on my screen. Too many things open. So I love this cartoon because it just kind of shows, this is sometimes how we deal with our emotions. But I think there might be a better way, right? And hopefully I can share some of those things with you today. So I'm going to start by reading this quote by Hermann Hesse. And I love this quote because I consider it kind of to be the first time that I discovered mindfulness. And I was in my early 20s, and I hadn't yet heard that term or started meditating at that time, but it really affected me. So he says, "You know quite well deep within you that there's only a single magic, a single power, a single salvation, and that is called loving. Well then, love your suffering, do not resist it, do not flee from it. It is your aversion that hurts, nothing else." And I remember, when I read this, I was going through a really hard time. I was in med school, and I remember sitting at my desk, and I was also going through some heartbreak. I was feeling really sad. And as I read this, I could feel this opening, this shift, and, just more spaciousness, and, what this quote is getting at is, can we learn to be with our experiences, not try to make them different than they are, push away or fight against our feelings, or tell ourselves that we should be feeling differently. It's really this just radical idea of embracing our suffering, and that actually this act of pushing against or aversion to our suffering actually perpetuates our distress, right? So, I was sitting there feeling sad. I didn't want to be sad. And, that was really the problem. So once I opened to the sadness, I felt so much better. I was still sad, but there wasn't this additional insult of me telling myself I should be feeling differently. So, it can sound kind of crazy, right? Maybe it's really hard to sit with things that are difficult. We don't like sitting with things that are difficult. Maybe we prefer to lie in child's pose for 3 weeks and avoid our problems. But, that's what we're learning to do here with mindfulness. And I think one of the main things, that really just makes mindfulness so powerful is that it helps us to rely on our own inner resources to deal with difficulty, right? It's giving us back this control. It's teaching us these better ways to meet the challenges of our everyday life. My teacher, Tanissa, in all of her wise, simple wisdom, once said that with mindfulness, we're cultivating our ability to tolerate reality. So it's so simple and so true, though obviously not as easy as it sounds to do. But, we can't get rid of a lot of our circumstances, but we can learn how to face them better. And so I want to mention the process of mindfulness a little bit. How does mindfulness relieve this, suffering that I'm talking about? So mindfulness meditation involves repeatedly observing the mind moment by moment. The content of a particular thought or memory or idea is less important than how we're holding these things and our reactions to them. And then this repeatedly being with and accepting our moment to moment experience leads to insight into the workings of our mind, which then provides relief from suffering. And in this process, we're learning a new way of working through things that's below the cognitive level. And then this process allows us to embrace the full range of our human experience. And I wanted to touch on some ways that, mindfulness-based interventions differ from other psychotherapies. The first thing is that we take on much more of a role of instructor as opposed to therapist. And there's really this idea that we're all in it together. And our own personal practice is really key in ensuring that we're teaching from a place of deep knowing, our own mindfulness practice. Another thing is that we're letting go of this idea that our job is to fix problems, and we're replacing this idea of fixing problems with allowing things to be as they are. And along with this, we're recognizing that the individual is really the expert on their experience and that our primary role is empowering them. Another big thing that I touched on is that mindfulness moves us away from a focus on content to a focus on process. And one way to think about this is a move from, why do you think this is happening to how is this happening, or what do you notice about this? So in terms of using, mindfulness as a treatment, here's a quote from the Mindfulness-Based Cognitive Therapy for Depression book, which highlights some of these points. So they say, most therapies are quite reasonably founded on the principle of getting as clear a view as possible of what has gone wrong in the past and what is going wrong in the present, then helping the person find the resources to cope better. They're based on the idea that assessing and then removing problems is the aim. Our analysis suggests that this will bring temporary relief only, unless people are able to use that respite to find ways to enhance their own well-being, take care of themselves, and relate to their problems in a different way. Both the research data and our clinical experience suggest to us that only when people learn to take a different stance in relation to the battleground of their thoughts and feelings will they be able in the future to recognize difficult situations early and deal with them skillfully. So, it's great to read all the books and to listen to all the talks. But, mindfulness is really something that can only be understood by practicing, something you really have to experience for yourself. And I'll guide us through a short practice in a moment. And just coming back to, emotions specifically, it's really easy to get swept up in emotions, right? And sometimes it's hard to separate ourselves out from the story about the emotion. But if we can just label the emotion and notice it and let it be, we can see that emotions arise and stay and eventually, fade away. Um, some emotions can be particularly unpleasant, and our habitual reaction to unpleasant things is aversion and need to get rid of the experiences that created the unpleasant feeling and to do all we can to prevent that experience from happening again in the future. And as I'm sure you're aware, we know that aversion has served our species very well through history, through our evolution. We can escape and avoid external threats to our well-being, like when you come across a rattlesnake in your backyard with your very tiny dog, and which happened to me the other day, and I lost my mind. But when it comes to our unwelcome internal experiences, this habit can really backfire disastrously. So you might be familiar with rumination, right? And rumination is in this habit co-ops our mind's capacity to think our way out of problems in this attempt to get rid of feelings of unhappiness. But the results are totally counterproductive. Rumination doesn't accomplish anything and it makes us feel worse. So have you ever felt better after ruminating? I know that I definitely haven't, but our brain thinks that it's helping us, right? When it's doing this, it's when it's going over and over things, it's like, why am I feeling this way? How did I get here? And let me think about it forever and ever and ever. So it can be just really empowering to discover that we can just be with unpleasant experiences without being overwhelmed by them, and that sooner or later these feelings pass. But not being overwhelmed by them is key. Everyone needs to learn about their own window of tolerance. We're not trying to torture ourselves or our patients. So there's a careful balance of pushing yourself a bit, to sit with things that are unpleasant, but not pushing yourself too far so that it becomes counterproductive. So maybe you or your patient is experiencing something that's too much, you or they can get up and do something else that would be more helpful. And we can all gradually work with this over time. You'll see for yourself what you need, and that's all part of the process. So I wanted to walk us through a little practice together, a practice called RAIN. Maybe some of you are familiar with this. And so RAIN it's a shorthand for using mindfulness in this way that we're talking about. The acronym helps us remind us, in the moment when we're having an intense emotion or difficulty of what we need to do. So it's a handy thing that you could use for yourself or you can teach someone else. And RAIN has been around for a long time, but this is Tara Brach's version. So I'm going to just lead us through a little practice together. So when you're ready, if you want to just, again, find, a nice comfortable posture so that you're alert and upright, but also at ease. And you can close your eyes or have a soft gaze, whatever feels comfortable for you. And again, just taking some deeper cleansing breaths, seeing if you can let go of any obvious tension in the body. And when you're feeling a little more settled, then you can start to bring to mind a difficulty that you've encountered, some situation or circumstance that brings up some emotional reactivity. It could be a fear or an anger or a hurt. It could be a situation in a relationship, a conflict, a place of misunderstanding or reactivity. Nothing too big or overwhelming, something you feel you can comfortably work with here. It could be something that goes on in your own behavior, some kind of tendency, or something that comes up around work or life that brings up a feeling of failure or jealousy or anxiety. And then once you've thought of this difficulty, the first step is recognize. So what we're recognizing is, are there thoughts, feelings, body sensations that are associated with this difficulty that are coming up? And just noting what's arising. Maybe there are certain beliefs, a critical inner voice, the squeeze of anxiety, or the weight of sadness. And then the second step, step two, the A is allow. Can you allow this experience to be just as it is? Allowing these thoughts, these feelings, these body sensations that you've recognized in the first step to be there without having to fix or avoid anything. It can be helpful to mentally whisper something to yourself, like it's okay, in order to acknowledge and accept the reality of our experience in this moment. And if there's something like judgment, we're not saying that we agree with those judgments, just that we're acknowledging that judgment has arisen. And we're also acknowledging whatever painful feelings might be underneath. Then the third step is the I, is investigate. Can you direct a more focused attention to your experience? And this is primarily somatic, not cognitive. So kind of asking those questions like, what is happening? Where am I feeling this in my body? What wants attention? What wants acceptance? We're just trying to allow a natural curiosity, really trying to step away from conceptualizing and into the felt sense in the body. And just trying to approach your experience in a non-judgmental and kind way as best as you can so that you can create a sense of safety for yourself and just honestly be able to connect to any fear or hurt or shame or whatever is present for you. And then the fourth step, the N, is nurture. So can you sense this hurting place and what you need? Can you offer some care to yourself? Is there a message of care that would be healing, like a message of reassurance or forgiveness or love? Or is there a source of compassion that you can offer yourself? It can be a really simple gesture of placing a hand on your heart that can be really powerful. Or you can envision being bathed in a radiant, warm light, or you can bring to mind a loving being, and that could be a spiritual figure, a family member, a friend, or a pet. And just imagine their love and wisdom flowing into you. Anything that can nourish you in this moment, even the smallest gesture. Then when you're ready, you can open your eyes again or lift your gaze and just come back to the group and just, see how you feel. It's just a small way of pausing and being with what's here, not fighting what's already here, and just offering some kindness to ourselves. So you definitely don't want to miss that fourth step. Sometimes we're like, okay, I investigated and acknowledged and allowed, and now I'm going to move on. So just make sure you offer that kindness to yourself, that nurturing. So I'll take a few minutes to talk a little bit about, mindfulness a little bit more in clinical settings, especially as it relates to emotions. And so rain is an example of this. You can bring this into the clinical setting. You can use it with yourself. You can use it with your patients. So mindfulness has become, very widespread, and it's brought this huge increase in the amount it's studied, which is amazing because then we can know what it helps with, what it doesn't help with. The American Mindfulness Research Association puts out this graph every year, and you can see about how many studies there are about mindfulness. And so you can see in 1980 there were 0, and then in 2000 there were 10, and then there's this kind of like exponential increase. And so that in 2021 there's 1,450, and then this 2022 was actually the first year it went down a little bit to 1444. So there's a lot of things that mindfulness based interventions have shown to be effective for, including depression, anxiety, substance use, pain. Obviously, I can't get into everything today, so I was just going to touch a little bit on depression. Here's another way of dealing with depression: screaming into the void. But I will argue that MBCT might be a better option. So mindfulness-based cognitive therapy, or MBCT, was developed by Zindel Siegel, Mark Williams, and John Teasdale. It was developed for individuals with a history of depression, and it's one of the most widely used and researched mindfulness-based interventions. It's based on MBSR, and the authors worked with John Kabat-Zinn to help create the program, and it combines these concepts of CBT with the principles of mindfulness to help prevent relapse from recurrent episodes of depression. So it's aimed at people that are currently in remission or partial remission from depression, though there are some more studies coming up now about people who are actively depressed. And then it helps teach people skills to prevent their depression from recurring. And these skills are what we've kind of been mentioning, right? Becoming more aware of body sensations, feelings, thoughts, and then finding a different way to relate to these sensations, feelings, and thoughts through mindful acceptance rather than these automatic, cognitive routines that have been perpetuating difficulties. It's 8 weeks, about 2 hours a week, then plus an hour of home practice. So it's really a lot of work, but it's really, really rewarding. And, the evidence for MBCT has been really promising. So, clinical research has demonstrated that MBCT is as effective as antidepressants in reducing relapse of depression. So I think that's really huge. And, as evidence has accumulated, some countries have even included the MBCT in their clinical guidelines. So the UK MBCT has been recommended by the National Institute for Health and Clinical Excellence as a treatment of choice for people with relapsing depression. So I think that's really great. And, the research is wonderful, and we want to see this. But what I really love is that, the people that come to the group really genuinely describe these just major changes in themselves as they do the course. So I just wanted to share a couple of comments from people who participated in the group, because I think it really just shows how powerful the practice is. And then I'll end and we can have some discussion. But so at the end of the group, I asked people to rate the group on a scale of 1 to 10. How important has the program been to you? And then I asked them to tell me why. So here is what some of them said. So one person says, the program has given me the tools and resources to better navigate through not only difficult times, but daily life in general, to better protect, nurture, and strengthen my well-being, and thus the well-being of those around me, to remember and proactively enjoy this life. Second person says, this program has been a lifesaver for me. It has helped me to get in touch with past hurts and emotional scars that have kept me in a deep sadness and guilty way of life. I was finally able to work through these things and learn how to deal, cope, accept the emotions that I feel on a daily basis. I stopped labeling everything I feel and just allowed myself to simply feel. For the first time in a very long time, I'm hopeful and willing to make the necessary changes in my life to keep myself healthy and living. Last one. I came to this mindfulness-based class expecting to find a way to control my anxiety and depression. In this program, I learned to accept my emotions, feelings, pains, and everything that is in my body and mind. I learned a lot about myself, and I learned to love myself as I am. It was a great surprise for me to understand that accepting our feelings, pains, events that occur in our mind, with accepting them and providing time to feel them, that is the way they won't bother us anymore. So I'll just put up my contact info.